it, we can get started.
All right, thank you. So my name is Peter Madsen. I teach American history to 8th graders at the middle school in Espanola, New Mexico. And I am the correspondence secretary for the local chapter there, Espanola NEA. So first, I would like to thank NEA New Mexico for organizing this event with the PED secretary, Dr. Ryan Stewart. And the recent announcement by the governor that gave school districts discretion to reopen middle and high schools under a hybrid model or to remain virtual for the remainder of the semester has resulted in a variety of responses across the state, and a lot of questions remain. We want to thank PED Secretary Dr. Stewart for taking the time to address some of those most pressing questions this afternoon. Given the importance of health and safety for school staff, students, and their families, we have opened this invitation to both members and potential members. For members who are here with us today, thank you for your ongoing investment and participation in your local unions to engage district officials. If you're not a member, welcome. We invite you to join us to strengthen our collective voice and to participate in your union. Joining has never been easier. Simply click a link that I will send in the chat right now. And then last, I'd like to introduce our state NEA president, Mary Parr-Sanchez, who's going to offer a few words about NEA New Mexico's collaboration with local affiliates, the governor, and the PED secretary during these challenging times.
So thank you, Peter. I appreciate that. And welcome, everybody. I want to just, I am looking at the chat and I see that the webinar mode is kind of throwing everybody a little bit off. So in webinar mode, the panelists, because we were expecting and are expecting quite a large crowd, this evening, we chose to do webinar, which means that only the panelists have control of their microphones and of their videos. So if you can't control that, that is why. And you don't need to sign in. We're just so happy to see that you are here. And I want to just thank all of you that have joined us here this evening. I know that emotions and fear and a lot of different things are running through us as the state is shifting from the governor and the Department of Health making the decisions about school reopening based on the counties and the 4 criteria, the gating criteria that the Department of Health has been using to determine how much the communities will open up. And this afternoon they just released a new map, and I'm sure many of you have not had a chance to see it because you've been busy doing remote learning and driving the school bus and preparing meals and all of the things that I know you do every single day for kids in New Mexico. So, but basically, the San Juan County, the northwest region of the state, is still in red, and the southeast region of the state are still in red. Bernalillo is green, Bernalillo County, and up and down the Rio Grande corridor, it's yellow and green. So we have made real progress in the state in slowing the spread of the virus. And we're very happy about that. And I think it's due to having a governor who has listened to the science and has done the hard work, even to much criticism. She has been very much criticized. And there was even a bill this legislative session to remove her power to be able to declare an emergency, a statewide health emergency, and to respond the way she did. The bill did not make it out of committee, but I was just on a call with the 50 state presidents across the country, and in Michigan, they took that power away from the governor in November. So it's so interesting to me. It's such an isolating experience, this working that we're doing right now. Like, I know I feel so isolated sometimes, even though I'm on Zoom meetings like all day and all night. It's still, it's just a weird place that we are, and we're so close with the vaccine, and there's been such disappointment around the vaccine. And the fact that those clinics were canceled in and around Rio Rancho and Bernalillo and Santa Fe, and educators were so thrilled to have, to be able to get the vaccine, and then the day before they shut it down, and it was devastating. So anyway, we've just had, it's been a roller coaster, and I know I'm preaching to the choir here, just the opening and closing, the hybrid, the having to relearn how to do all of our work in a completely different way, has brought us here to this moment right now. And so I want to start our meeting today by doing a land acknowledgement. NEA National passed a new business item a couple summers ago, and it is that we acknowledge the land that we meet on in all 50 states, which we have been doing. So we begin by acknowledging that we meet on the traditional lands served by the people of the 19 Pueblo tribes, the Navajo Nation, and the 3 Apache tribes. We honor America's first people and all elders, past, present, and emerging, and we are called on to learn and share what we learn about tribal history, culture, and contributions that have been suppressed in telling the story of America. So we are getting ready to publish another report with survey data that you all, 3,000 educators across the state, completed a survey, and we compiled the data, and we are going to be disseminating that information. I think it's going to go out to all our members on Friday. And if you're a member and you haven't been getting a newsletter from NEA New Mexico or from me, Mary Parr-Sanchez, and I am Mary Parr-Sanchez. I'm a middle school teacher. I also taught 8th grade U.S. history. We've been sending newsletters every couple of weeks to try to keep our members in top shape as far as knowing the information as we know it. And as you all know, information is changing rapidly. So we're waiting for the PED secretary to join us this evening. I don't know if somebody can check to look in the attendees if he's here, and we can promote him to a presenter, but I know he will be joining us very soon. He was driving from Tatum, New Mexico to Vaughn, and he's going to stop in Vaughn and do the town hall there. So I hope we can have a little bit of patience while he gets on the call with us and can answer your questions. So I was given many questions from around the state. And there's a lot of concerns, and I have to tell you that across the nation, there are so many things that are similar going on. And so, for example, besides school reopening and the vaccination and sports and athletics and some kind of expanded, hybrid model, the thing that is on a lot of legislators' minds and parents is they want to add days to school. And either, I thought it was going to be this year, but we've been able to stave that off. But starting next year, there are bills in the House and the Senate right now in our state and across the nation where legislators, because they're listening to parents, and probably students and some educators, although I know educators have some really strong feelings about this. There is a lot of talk about doing some type of extension to the calendar starting in the 21-22 school year. So we're going to be giving you much more information on that. We are going to monitor those bills closely, and let you know where we are with that. So I do see that the secretary is joining us, and we're so happy that he's here. It's been a really busy time for everybody, and we have worked very, very hard with the Department of Education, the New Mexico Public Ed Department, and with the governor. And we have some of the strictest safety standards in place of anywhere in the nation. But I do know that some school districts are not playing by the rules. And I want you to know that the New Mexico Public Ed Department and the Secretary and NEA New Mexico, we are here to for those very purposes, to hear about any safety violations and to respond, because you are important to us. And educators are also feeling like second-class citizens, according to presidents from across the nation, that, you know, feeling like the whole vaccination thing, it's the same situation in every single state. And so I just want you to know that we appreciate you and the work that you do every single day. And with that, I don't know if Dr. Stewart is able to turn his camera on. If not, can somebody please help him? And there he is. Yep. Okay. Well, I want to welcome Dr. Stewart. He you know, he has been working like really, really hard too. And this has not been easy on anybody. You know, we know our kids are hurting. We know our parents are hurting. We know our educators are hurting. It has not been a picnic in state leadership either. So I just wanted to start off just to say that we are so glad to have Dr. Stewart here with us today. And with that, I'll welcome him and turn it over to him for a few opening words.
Thank you, Mary, and thanks to everybody who made some time to be here. I apologize that I was running a little bit behind. I'm coming to you from Vaughn Elementary School, and I had a great chance to be in 3 different districts in southeastern New Mexico today, and 3 different ones yesterday. And I'm on my way back to Santa Fe, and then stopped in Vaughn Middle School to see this school, and then also be able to do the town hall from here. So again, appreciate the patience as I was getting logged on here. And as always, Mary, I appreciate the invite to be able to address your members. To say that this hasn't been a picnic on anybody is understatement by surely. And I know that certainly applies to every single one of your members for whom this has been the most difficult year that we've had to face. It was great being in some schools today. These were a number of schools that opened up in hybrid this week, and seeing teachers, seeing students, being able to talk about what the experience has been, to see some of the protocols in action and get to talk directly to the students, to the teachers, the principals, the superintendents, the board members, the custodial staff, the cafeteria staff, and all of the frontline workers, and just get a sense as to how things are going. And it's heartening to see all the work that goes in to make this happen day in and day out. And I know that as we're in this particular period, there's a lot of different decisions that are going to get made in different communities, certain things that will work in different communities, different schools, different districts, and certain things that don't. And so I know that those are ongoing conversations. And at the public education department, as Mary said, we want to make sure that no matter what decisions are being made in a local community, that safety is front and center and first and foremost, and that also our students, our schools, our educators are supported to the very best of our ability to do so. So, Mary, happy to turn it back over to you and dive into the rest of the agenda, and look forward to the conversation.
Thank you, Secretary Stewart. And I don't know, for those of you that are joining us that aren't our members, and even members that may be joining us tonight for the first time, we hired a new executive director in the first part of this year. And since then, well, actually, it's been a year now. I don't know what I'm thinking, but since March, really, of when the pandemic started, and that was in 2020, right? Yeah. We have been having these town halls with Secretary Stewart, like right out of the gate. And we've had a town hall with him. We've probably had, this is like our 10th town hall that we're having with him. So he has really been generous with his time to address concerns that I know people have. And so we're going to get started on the questions that have been submitted from around the state. And the first one is, extracurriculars are extremely important for our students now more than ever. They not only participate for something to do, but may depend on these activities for scholarships. What needs to be done to allow all students to be able to participate in sports?
Yeah, and this is a great question, and I know one that even on the visits today, talking with many of the students and the coaches and so on, that you just see the importance of this for so many kids. And I know it's been a topic of very hot discussion in probably every community in the state. So I'll tell you a little bit about where we have been on the decision and where we are with it. So if you saw the press conference or the materials that were sent out when we announced the expansion of in-person learning eligibility, you saw that with regard to participation in NMAA sanctioned activities, that would be allowed following the 2 weeks following when schools would open, and that we would keep a close watch on how the openings would go and make sure that all the proper practices were in place and that we weren't seeing systemic outbreaks, and that also there was a requirement that the school be moving into the hybrid model in order to participate in those activities. And the reason why we had that requirement for a school to move into the hybrid model was around making sure that as we were expanding in-person activities, that we were focusing first and foremost our energies on getting kids back into the classroom and making those available. And we know not every student's going to want to come back. Anywhere from 20 to 40 and sometimes more of any district is staying online. And that's, we anticipate that, and that's perfectly fine. But for those who are wanting access to in-person learning, that they would have that ability to some degree. Now, I know that there are a number of issues with that, because it's incredibly challenging right now with staffing to make sure that that's there. Also making sure that all the safety protocols are in place. These are conversations I know Mary and I have had a lot of conversations about this particular issue, as well as with the NMAA superintendents, charter leaders, teachers, families across the state. And so it's something that we've been looking at really closely. All of these kinds of decisions, it's both the public education department, our public health officials, the governor's office, in this case, NMAA. We want to make sure everyone's kind of on the same page about what this looks like. And so I think these conversations are, we're still having them, even as we continue to get more feedback and look at some different options and see if changes will be made there. As of right now, there haven't been any changes that have been made, but that may change in the near future. And so that if changes are made, that could lead to the expansion of additional students and schools that would be eligible under those circumstances. But again, those are ongoing discussions, and we're looking to get some final answers around that here soon.
Thank you, Secretary. And there was kind of an alarming comment in the chat. And Brian, if you're still on the call with us, I would like for you to reach out to me, to call me right away at 571-3293. We need to talk, because if you need to have an accommodation made for you to remain virtual, and it definitely sounds like you do need to have that happen, I need you to call me and we will get that worked out for you so that you can continue teaching. So sorry about that. Second question. Some more financially able districts may be able to go into hybrid learning immediately, but some districts may be waiting to get back-ordered filters or hire the person power to get classrooms ready for students. How can we advocate to get all our students participating in sports, whether they are hybrid or virtual or somewhere in between? And that's kind of a similar question to the one you just answered, but
Yeah, and I think with regard to the sports piece, the response I gave in number one applies similarly here. I think one thing that's interesting on this question is around the financial ability of districts. I just want to talk a little bit about some of the financial pieces that are here. When it comes to a lot of the coronavirus related issues, so we know that we had the CARES Act, and we were able to get that was about $100 million that went directly out to school districts through the Title I allocations for a wide range of uses, including coronavirus response being, of course, a huge one. So all of the cleaning supplies, all of the PPE, all of the additional enhanced safety protocols, and so on. Those were all eligible expenses under CARES Act. And then recently, the federal government passed I always get the acronym wrong, Coronavirus Response and Relief Supplemental Appropriations Act, the CARISA funds. And through the CARISA funds, that's actually about 4 times as much as the CARES Act funds. And similarly can be used for that same wide range of purposes. So that includes things like the filters. It includes things like if you need to be able to supplement with additional support personnel and so on. Those are all allowable uses with those new funds. And so one of the things that we've tried to do, most of that money goes directly out to the districts through Title I. The state has access to some of that money to also be able to support for emergency uses. And we did put some of that money toward filters with the CARES Act. We'll put more into that through the CARISA funds that were just released as well. And so we're hopeful between these two funding sources that the finances aren't the thing that would stop a district from being able to go back into hybrid. We know that there are a lot of needs out there, but with some of these supports, we're able to make a big dent into that.
So I am seeing in the chat several questions around medical issues and being able to stay in a remote environment. So could you address that? Because I think they need to hear it from you, what they need to do, and if they're unable to work in person for medical reasons.
So our guidance, and we released this initially back in either the spring or late summer, when the CDC came out with their list of conditions that were at high risk that were high risk conditions for serious complications from coronavirus. And so what we said at that time, and which we still say today, is that those staff who fall into one of those conditions, that you would have the right to have an alternate work assignment. And so there were, I can't even remember how many there were, but there was a whole category of them that the CDC listed, and so we followed on that, and we've kept that guidance intact. And so our position on that hasn't changed. We actually have a forum that we worked with both the unions and HR managers and superintendents and charter leaders around the state to for staff to be able to fill out if they're in one of those high risk conditions, which makes it really clear what the diagnosis is and how it aligns with CDC guidelines, and to try to streamline that process. So if you're having issues there, certainly make sure that you're checking out and using that form, and then following up. I know Mary is always helpful in reaching out to us if we're finding any instances of places where the process isn't working the way it is, so that we can help make contact and intervene and support a school district or a charter school where necessary, to make sure that everyone's on the same page with requirements there.
Thank you, Secretary. Yes, and it is an interactive process that you become engaged in when you ask your Human Resources Department to begin paperwork to stay in a remote learning environment if you meet one of the criteria that the Secretary was referencing. So please do reach out to us if you need help with that process. So another question, Secretary, what do we need to do to get educators moved up in the tier system for vaccines? So vaccines is a really hot topic across the nation right now. So I'll let you have at it.
And there might not be a more discussed or hotter topic in the nation right now on anything. Maybe it's that and impeachment. It's probably the two big things that people are talking about. So when it comes to vaccines, what the state has done with regard to educators is a couple of different action items. So number one, we did work with DOH to make sure that educators were categorized and prioritized as essential frontline workers to get into that 1B category. So 1A was our healthcare workers and those residents and workers in long-term care facilities. And then 1B is the critical frontline healthcare workers, those who are 75 and older, and those who have underlying medical conditions that would put them at risk for serious consequences from the virus. So with the healthcare workers, that includes our school nurses, and it includes our school health aides as well. So all those individuals could register as healthcare workers. When it comes to vaccines for the 1B category, all educators who fall into that 75 or older or who have underlying medical conditions are eligible to be vaccinated right now. That's the group that has been prioritized within the within that 1B hierarchy. So again, these are the people most at risk of having a serious complication from the virus, and that could lead to hospitalization or death. So as a state, we want to make sure that we are getting those individuals vaccinated and protected first and foremost. Then that next category is the 1B category. And so that's for all educators who don't fall into the 75 or older category or don't fall into the underlying medical conditions category. You are that group, you are in that next category group that will receive the vaccinations. And we've been working with both the NEA and AFT to make sure that when we get to that point, we're able to really coordinate well with schools across the state. so that we can make sure that you have local access for educators in some of these mass vaccination events to be able to have access to those. A lot of it really is supply issue, and it's supply. We're constantly advocating for more to be sent to our state. I know the federal government has really been trying to surge more vaccine generally out to the states, and we saw about a 16% bump in the number that we're able to get into the state. And we're doing a pretty good job of, once they get here, getting the shots into arms. So I think last time I heard that we were about third in that vaccination rate of actually getting shots into arms of all states in the country. It really is a matter of how quickly can the manufacturers and the federal government get more supply to the state so we can continue moving more and more quickly through that list. But what I would want everybody to hear and walk away with is that educators are prioritized in this group. And we do have to be careful that we tend to those who are most at risk during the pandemic. So those 75 and older, and those who are medically fragile. But educators are certainly in all professions in that group that we are working very hard to get to. And we know that the more that we can get educators vaccinated, the easier it will be to come back with confidence into the classrooms. And we take that seriously, and we're trying to do all we can to make that happen.
And just as a follow-up question, Secretary, and you had also addressed educators that work with high needs children, where the children may not be able to wear a mask, and or they're at extra exposure because they're diapering or doing things like that. Could you address those educators?
Sure. So I think and this has actually come up recently, and we've seen some emails and maybe some misinformation going out around this. So we want to be clear that there are certain categories of educators who would fall into the healthcare worker status. So school nurses, health assistants, very specifically, would fall into that status. We've also kind of within that group, and sometimes it's the health aides, but sometimes it may be another individual in a school who does the, say, changing of a feeding tube or the diapering, as Mary was saying. And so some of those activities in which you are very close with the student and in that close contact would also be in that healthcare workers group. But I want to be very clear about what that does mean and what it doesn't, because it doesn't mean that, if you have a medically fragile student who maybe they're included in your class, or at some point you may interact with a medically fragile student during the day. That's not the intent of that healthcare worker designation. It really is for those who are doing those actions with a student that really would qualify them almost more in that healthcare phase, the diaper changing, the feeding tube changing, the very close contact activities, and not kind of the more generally working with a medically fragile student, as I think I've seen some emails that may have suggested otherwise.
Okay, thank you. And so this one is about, why is my principal, who is on an accommodation, being made to go back in person without a vaccine? If even one person dies, it will be too many. And so I also saw in the chat that they didn't believe principals could be represented by NEA and or AFT. And actually NEA does have many administrators that are members, including superintendents. So anyway, I just thought I would correct that statement. We do represent administrators, but if you would take that question, please, Secretary.
Yeah, thanks for the question. And I think it goes back to what I was saying in the earlier question about medical medical status and what our guidance has been with regard to having the ability to have an alternate assignment. So when it comes to the guidelines from the CDC, which outline the high risk categories, our guidance has been that those who fall into those identified categories would have an alternate assignment, and the form I referenced. And I think while we certainly need to protect our teachers and our custodians, our food service workers, we want to protect everybody who's going to be in the school setting. And so I think there's certainly when it comes to protecting the health and safety, we don't want to exclude the ability for all school staff, no matter what role they're in, administrative or not, to be safe in that role. I don't know the particulars of this situation. It hasn't come across my desk, but I would certainly think that we'd want to work with this particular principal in school to make sure that their exposure was not being that they were not being exposed and put in danger given their health condition.
So this is a question, I'm skipping around on the questions that I shared with you, Secretary, but it's one that's coming up a lot. And I really think that it's also a cultural, it's a cultural value in New Mexico that multi-generational families live together and take care of each other. So older parents, grandparents take care of children, and as they age, children take care of their older parents and grandparents. And so a really big concern is that what if you are the caretaker? And I know that this is true in many cases with educators, because we're caring people and we care for others. It's what we do. It's in our DNA. And you are the only one that is able to take care of your aging parents, and you are required to go back in person. You've tried to get a remote assignment, but you've been denied, and you do not feel safe at school because you're afraid of what you may take back to your parents.
Yeah, and this is one area that we've looked at closely, and I know we've had our legal teams look at really closely too. And when it comes to the accommodations that we've talked about, there's rules and requirements that we've put in place to really that speak to the employer-employee relationship, and making sure that as an employer you're taking into account the risk needs of your employee in that relationship. Where it gets much more complicated is in situations like this, where it's not the employer-employee relationship, but it's a relationship between the employer and then someone related to the employee, or for whom the employee is a caregiver. And so in that indirect line of a relationship, I think the ability of the department becomes much more, for lack of better word, I don't know if tenuous is the right word. Maybe murky is the right word. Or, but anyway, there's not a clear line that would enable us to say, not only must you take into account the circumstances of the employee, but also those who are in close contact with the employee on a regular basis, or those in the employee's household or family. So in that circumstance, there is more that has to happen with local discretion with how those get handled. In some circumstances, those have been considerations that employers have been able to make. And in others, the outcome may have been different. It's not necessarily something at the state level where an umbrella statement can necessarily be put forward in the same direct manner as employer-employee.
Thank you. I know that's a tough question, but it is a question that I get daily. And it is a very legitimate question
Mhm.
because it does speak to our culture in New Mexico, of taking care of family. So I'm going to kind of switch to band and choir, and we did receive a number of questions about why students that are socially distanced and why they can't play an instrument, if we're opening up sports, why are band and choir, which are really important. I know my kids were band students, and it really was a godsend in middle school and high school. And so that's the question, Secretary.
Thanks, Mary. And similar to athletics, this has been another really, really big question, and one that I know I get lots of outreach on personally on this one. I'll talk a little bit about kind of why we haven't allowed band and choir so far, and where we are going forward. And if I can share my screen, I pulled up here. This is so we have a whole wing over at DOH in our epidemiology unit that basically culls all of the articles that come out with regard to COVID, COVID generally, but COVID in schools particular, with our schools liaison. And they do a really good job of keeping us abreast and summarizing what's happening. This is just one example of an event study. This one's from the CDC about choir practice, and in this one, if I recall the details of this one right, it's from March 2020. I don't know that they were doing a great job practicing social distancing at this particular event, but it's one in which it was a choir practice, 61 people attending, and then you had 32 and up to 52 cases include that wound up in several hospitalizations and 2 deaths from this particular practice. And generally in the literature, when we've been looking at what's been happening with choir and band and people measuring aerosol spray coming from projected voices and from wind instruments and so on, those have been from a trajectory and just pure expulsion of droplets standpoint, 2 of the more dangerous activities to happen, especially if they're happening indoors and distancing is not there. But even when distancing is there, the 6 feet becomes even more problematic isn't the right word, but they can spread further than the 6 feet of just normal projected volume when you're playing those. And so that's why we've been very careful with band and choir, especially. Now, as we're learning more, we're working a lot with epidemiology. We're looking at ways where this has been conducted safely and examining more data on what's happened if you have, say, more distancing or if you're doing some things outside. So we've been studying those and we've been in conversation with our partners in epidemiology to try to get some updated guidance from them based on what we're seeing in this across the states. And we'll likely be coming out with some updated guidelines around band and choir soon based on that. But I just want to say we recognize that for many kids, band and choir are really, really important activities and a big part of their creative outlet, a big part of their identity and things that really keep them motivated in school. We want kids to be participating in these activities, but we want to be sure that when we do allow it, that we can look their parents in the eye and say, hey, we've done a lot of work and we think we can do this safely. And so again, stay tuned. I don't want to get out ahead of the data of our epidemiology team, and but I think we've been looking at this issue and we'll issue some updated guidance here.
Okay, thank you. Yes, I did get several music folks ask questions about that, and I know it's frustrating because it is so important students. And so here's a question from an educational assistant who works with pre-K to 5th grade. And this educator would like to get vaccinated when they can, but feel that they need to be paid hazard pay because their work exposure is greater because they are the ones that go to relieve. Like they literally work with pre-K through 5th grade, and they're relieving the classroom cohort teacher to go to lunch, which is great that we have people doing that. But it does put those workers who can be some of the lower paid folks in our system at greater risk. And can they be paid hazard pay?
So, so first of all, there's a question about kind of what state versus local role and what's allowable kind of at each level. So I'll break apart the two, and I'll start with the state. And so first of all, as you all know, most of the education money goes directly to the local school district, who runs the payroll, who does the collective bargaining, and so on. A lot of that happens at the local level. And so when it comes to kind of changes to the terms of those, of who gets paid what, and so on, that most of that happens at the local bargaining table, kind of separate and apart from what the state does. I think the state does set some minimums that are required in terms of salaries for various positions and so on, but a lot of that happens through local bargaining. Now, at the state level, what we are working on are in the money that we do have available, and again, which is a much smaller fraction than what goes directly out to the districts. We do want to see what we can put forward toward making sure that we're supporting our schools and districts to be able to take care of their workers to the best extent possible. And you've had some very strong advocates on this from your union leadership to see what is it that we can do to help from state funds. And so we're actively working on some allocations that would help support primarily in the sick leave. So making sure you can stay secure in sick leave, and also looking at, what other kinds of incentives we can provide for those who are coming in person. So again, I think the majority of this work is going to happen with your local bargaining unit, but where the state can make a difference, and I think we can help support and make a significant difference with especially with some of the federal funds that have helped. We're going to try to do all we can in that area.
Okay, and this kind of makes me think of something that I want to share before I go on to the next question. And that is that districts, they have more money than they're letting on. And, people are asking about custodians and are there enough custodians? And it was my good friend from Las Cruces asking about the custodians. And, districts have been given COVID money from that first round of money that the federal government sent out. And in addition to that, cash balances and reserves that districts have are higher than they've ever been. So I wouldn't accept that face value that I would ask your district, how are you preparing the schools to get ready for these kids to come back? Because we do need to hire more custodians because there's more cleaning that needs to be done. Ask the district, how have they spent their money to make it safe? They should be making that case to their employees and to parents and families. So do that, because I think you might be surprised by the answer. This constant that we're in a deprivation, that we can hire people, I don't take it at face value. You need to push back on that kind of thinking, because districts do have money. So this is an instructional question. How are we going to reach those students whose parents do not send them to Zoom classes or support their learning and classwork?
So on this one, and it's always really helpful to hear directly from our teachers and our students what their experiences have been. I've had the privilege of having focus groups with teachers and families and students throughout the state through a large percentage of the pandemic, and I get to go to a lot of schools from around the state and hear exactly what's happening. And I think in a lot of cases, I'll break this out into a couple of different segments. Um, One of which is those students who have circumstances where there are some barriers out there when it comes to being able to participate regularly, and those barriers can be everything from technology, not having reliable internet, to socioeconomic issues where you may have a parent who is working multiple jobs and not able to kind of carefully monitor their young students when they're participating in the online program. And then you have some other circumstances where maybe it's not one of those barriers, but you have a student who's going through crisis, or you have a student who. Sorry, I was getting some feedback there. I'm sorry, my internet connection is lagging, so I'm hearing myself again. Is everyone else hearing myself after I speak? Or is that just me?
You're okay now.
Oh, okay.
We're all muted.
Okay, great. Oh gosh, I just lost my train of thought. I think I was talking about students who have barriers, students going through crisis, or students who feel like they're falling so far behind and this isn't their learning mode, and they're starting to give up. So I think it's really important that a part of the work during these extraordinary times is really trying to understand where that's happening, and to understand where the school or the educator has the ability to make some difference in those. And we don't always, because we can't be everywhere at once as educators, but there are some times where we do. And finding those times and to be able to connect with that family, that student, and help move barriers out of their way, either directly or through our partnerships with community schools or social service agencies or children, youth, and families department, who has a families in need of support process that is completely non-punitive, that we can connect with. Those are really important avenues to take advantage of. Also, our Graduate New Mexico program that we've invested in at the state level. Engage New Mexico program that we've invested in at the state level, where we can actually, for those students, get an adult coach who will regularly reach out to that student and be able to help them problem solve through their academics, or provide a voice to talk to and help hold them accountable to making sure that they're getting their work done on a daily basis. So I think there are a number of supports that are out there. I just encourage, to the greatest extent possible, making sure that students just have someone who's checking in with them. And I've talked with multiple teachers and students who say, like, I was really struggling, and I wasn't getting my work done. And the thing that made the difference for me was I knew if I didn't hit submit, that I was going to get a reminder email from the student wellness team, or from my counselor, or from this teacher, or from the school secretary, and everybody having people at the school who are assigned students to just check in on if somebody flags them as falling behind or struggling. Some of those systems issues have really made just the biggest difference for kids who otherwise might have fallen through the cracks, but they know that there's somebody there who's checking on them, who's counting on them, who's holding them accountable, and who's a support for them there to let them know that people notice when they're not there, and somebody's going to say, hey, it matters to us when that doesn't get turned in. There's no easy answer to this. A lot of it is problem solving as we're navigating all of these new waters and new ways of being, whether we're apart or together. But I think some of those have been some of the things I've heard in my conversations with families, with students, with educators, that have made the biggest difference.
Thank you, Secretary. And I know you're traveling and we want you to be able to get back on the road quickly. I want to just, the last two questions are about the reentry guidance. And I think a lot of people may not be familiar with the reentry guidance because one of the questions is, what are schools mandated to provide staff in as far as PPE, and also if you could address the issue of requiring 100% of the staff to go to the school to work in a hybrid environment. And those will be our two final questions this evening.
Sure, and I just linked in the chat there the website. It's our reentry district and school guidance website, where you can find links to just about everything that we've posted during the pandemic. And there's our main reentry guidance, and then our main rapid response toolkit. A lot of the information is contained in both of those documents, and then down below there are, oh gosh, what are we up to? Dozens of additional supplemental guidance documents that are there as well. Everything from academics to school safety to general reentry support documents. So then, generally speaking, Mary, to get back to your questions, what's required in terms of educators and their PPE? So there's a whole list of protocols around what kinds of cleaning supplies need to be in place, and hand sanitizers and alcohol content, and making sure that there's access to soap and sanitizer both in the classroom and in the bathrooms and in other areas. So I won't go through all of those, but those are all listed in there as well. When it comes to the personal protective equipment, in addition, we've asked that every single staff member needs to be provided access to multi-layer cloth masks, or some of the high quality disposable masks as well. And we've distributed over 1.5 million units of masks throughout the state, just at the state level. And that's in addition to what districts have procured as well. So there should be no reason why anybody across the state doesn't have access to a mask provided by their employer. And again, some of those may be reusable cloth masks, and you should have access to multiples of those, and then additional disposable ones as well. We've also distributed what we call a close contact kit. So just at the state level again, we surveyed how many people are out there that have a close contact assignment. Again, you're changing diapers, you're changing feeding tubes, et cetera. And we bought and have distributed out now masks, and these masks would be either your surgical, your KN95s, or your N95s, something that's more medical grade that nurses would wear in hospitals. We've also distributed out, I believe there's face shields, gowns, and gloves that go in those close contact kits as well, so that you can be those people who do have a close contact assignment can have those additional supports as well. And that's just what we've done at the state level. Your districts have also secured PPE and made that available. So again, we expect everybody to have what the medical professionals are recommending, and that's been for most people who are in a general teaching assignment. That's a multi-layer cloth mask, and then the access to the cleaning supplies and so on. And then for those who are coming in to less than 6 feet, because of those close contact assignments, you have those kinds of close contact materials available. And then the last question you asked was coming back into the building. So we sent out a memo. I'm sorry, go ahead, Mary.
It's that situation of requiring 100% of the staff to come in to a hybrid situation.
So our guidance on this has been, I think, consistent throughout the pandemic, and that the public health order says that everyone should do their best to stay at home as much as possible and minimize contact. And so in the education world, that means there's certain things that you have to be on site to do. In-person learning is something that you have to be on site to do. Food service is something you have to be on site to do, custodial services and so on. If you're not doing in-person learning, if you are teaching remotely, then our guidance has been anything that can be done purely remotely should be done purely remotely. And so that guidance hasn't changed. If you have a fully remote teaching assignment, then our guidance would still be that you not be required to come into the building, that you be allowed access to the building. If you are more comfortable teaching from the building, or if you don't have internet and you don't have sufficient internet at home and you need to use the school's internet in order to teach, then you can come in to teach from the building, but that's not a requirement that you do so.
Okay, Secretary, we're so thankful and appreciative of you joining us this evening. I know you did a Herculean effort to be with us, but you did reach over 200 educators this evening, and I know that it is really important to them to hear directly from you. So I can't thank you enough. And so thank you so much. And I would just tell the educators that reach out to NEA New Mexico, go to NEA-NM.org, and we can certainly help you. Any questions that were not answered that are in the chat, and there's a bunch, we will answer those questions. We'll send them where they need to go and get you answers. And if you're not a member, please join us, because we're stronger together. And that's really, we're all educators on this call. Every single one of us works in a public school in some capacity. So stay safe, everybody. And thank you, Secretary. Drive safely, and hopefully we'll see you soon.
Thank you. Thank you, everyone, for attending.
Thank you. Bye.